recording. Hello, today in our MK Cognitions interview series, we'll be learning about Carla's experience with pain and how treating mercury toxicity has helped her.
Carla, thank you for coming.
Thank you for treating me.
It was definitely a journey for you. We've met about a year ago, maybe a little more.
Yeah, I think February.
Yeah.
Exactly.
Oh,
exactly
yeah,
1 year.
it's exactly a year ago. And you've had this pretty significant number of different pain syndromes. I mean, I think the condition that was officially described was neuropathic pain, and I want you in a minute to tell us how you felt it. And your journey was pretty, I would say, for my practice, is pretty usual journey for some of my patients, or for a lot of my patients, but your response was quite good. And I think you also told me on several occasions that you were so grateful that you thought that coming and talking to us would be good. So thank you so much for coming. And
Well, thanks for treating me.
Yeah. So tell us about how has been your experience with this process.
So I would say that for about at least 10 years, I have had a liver pain, and bladder pain.
Mm-hmm.
And I increasingly started having problems on my left-hand side. And I had traditional physicians. I had one physician who was probably well-intentioned, who I saw for maybe about 10 years, who was very upset because every time I took statins, my liver hurt a lot, so I stopped taking them.
Mm-hmm.
I had high blood pressure, and she said that I had to take high blood pressure pills because the reason was that my father had high blood pressure, and I explained that I had a very different lifestyle. I have a very healthy lifestyle, and I was surprised that I had high blood pressure, and I needed to understand why I had these problems.
Mm-hmm.
And I complained about the pain in my liver, the pain in my bladder.
Did you have any other pains in your legs?
And my left side started getting weaker,
Mm-hmm.
much weaker, and I started
Mm-hmm.
having pins,
Mm-hmm.
like
pins
little,
and needles,
like ants going around.
Mm-hmm.
And I got tired because this physician didn't
Mm-hmm.
solve my problems. I went to see another physician, and then nothing happened there. And then I went to see you, and I said,
Mm-hmm.
I feel healthy, I feel happy, but I have these pains, and I'm worried, and I don't understand why I have high blood pressure.
Mm-hmm.
Why is it that I have these pains and they don't go away? I don't want to get cancer. I don't want to get bladder cancer or liver cancer.
Mm-hmm.
And you suggested that I have a mercury test.
And the reason I suggested that is what you're describing. I assessed your lifestyle, and you're exactly right. Your lifestyle is very healthy, and it's very unusual to start developing all these problems, these different pain syndromes and elevated blood pressure. And I think at some point you also were describing to me a little bit of anxiety and sleep difficulties.
A lot of anxiety, yeah.
Yeah. So those are all symptoms that we see quite frequently with the mercury toxicity. And as I pointed out to you a while ago, you've also had a mouthful of silver fillings, which are 50% by weight mercury. So that's how I think we very quickly said that we should get the mercury test, and it came back very elevated. And subsequently, we've detoxified your mercury levels, and we also replaced all your silver fillings. And how are you feeling today?
I feel much better. I think I didn't realize how bad I felt. I mean, I've always been a very high energy person, so
Mm-hmm.
I was functioning fine. But it's much less effort to
Mm-hmm.
have all that energy now. I feel much better. I thought that I had bad vision because I'm very short-sighted.
Mm-hmm.
But after I started treating the mercury, I realized that I had very severe tunnel vision. And now I started discovering vision on the sides
Mm-hmm.
of the space. I saw colors are shinier, the lights are brighter. I feel much better, and I actually am very scared of the fact that maybe I wouldn't have come to see you. Right?
Well, you did, thank God, and
so
I'm glad you're better. But you earlier raised an important point. You just went to one of your other physicians, and physician was sort of dismissed your problems. And when you mentioned what you went through, the physician was not very happy, which, from my perspective, is surprising. And how did that feel to you, that somebody didn't validate you?
I I was surprised because I would think when somebody comes to me and tells me there is something, people miss things. Although I must say that after you diagnose the high mercury, not only do I feel much better, but I also did a lot of research. And for example, the National Academy of Hypertension or something like that says that if you have a patient who has high blood pressure and you're not sure why this person has high blood pressure, you should always do a mercury test. And I thought I spent a lot of years getting sick and paying a lot of money, and I'm just puzzled. I mean, I think traditional insurance companies also don't recognize the problem that mercury is. I had to pay a huge amount of money out of pocket to get the mercury out. I was able to. I think there's going to be a lot of health problems for a lot of people if the traditional companies don't realize that this is a growing problem.
We do know this for a fact, that there's a lot of mercury toxicity, especially in the United States. There are several parts of Europe that outlawed silver fillings. Norway is a good example because the data is quite consistent, and unfortunately American Dental Association continues to deny this problem. We're probably going to see in the future a lot of research supporting the idea of mercury toxicity. Unfortunately, we live in our current age where you still have this reaction, like your recent visit to a doctor, where your doctor was very dismissive of that this is actually even a problem. And so, what would you tell to the patients who, your friends or your relative, who you may think may have this problem?
Well, the first thing I would say is that anybody who has mercury in their mouth should go directly to their dentist and they can do it year by year. If I had known, I would have probably had that this could be an issue. I would probably have told my dentist, please remove up to the dental ceiling this year. And then next year, keep on removing, so I wouldn't have to pay all thousands of dollars out of pocket and be sick. So the first thing I would say is nobody should accept that they or anybody in their family has mercury in their mouth. The second thing is that actually I feel a lot better, and even though I thought I was okay, I think people should realize that they can feel better once the mercury is out. So they should be very careful with that.
Yeah, I hear this over and over again. You're right. We often don't feel what our baseline is, and if we don't realize that the baseline of our feelings can be a lot better, we tend to live our life thinking that this is normal, and it often is not. The removal of feelings is not, unfortunately, is a lot more complicated issue. I think if somebody is very healthy and they have only one or two fillings, I think it's very reasonable to have them removed with a dentist who does not practice safe methods of removal. You've had quite a number of them. I think by the time you came to see me, I think removing them all with a regular dentist potentially could have presented an additional challenge, because during the drilling with a regular drill, a lot of vapor gets released, and some patients actually can get more toxic after the removal than before. So we, in MK Cognition Institute, Dr. Singer has been doing a lot of removals in a very safe manner, where the removal gets done in such a way that the exposure to mercury vapor is minimized.
I agree. Actually, my normal dentist, my regular dentist, said I could do one or two, but it's not safe for you or for me to do to have all of these removed. But I would say I don't think anybody should have mercury in their teeth. I think people should not accept anybody putting silver fillings in. My kids don't, but because my kids have good dentitions, I raise them well, so they basically don't have fillings. But I think people shouldn't have mercury, and I think they shouldn't accept that from their dentist.
Well, the good news is I think society is now patients beginning to recognize this being a problem, and I think there's a pressure on dental associations to really use the amalgams less and less, and we are seeing a movement, slow movement, but in decrease using of annual amount of mercury in the United States. Although if we compare our use of mercury fillings to the Europe, it's dramatically higher use. So, but hopefully, again, as I said, there's a movement and there's a beginning of understanding that the mercury represents a very substantial health challenge. So hopefully one day we won't need to have discussions like this, because there will be really no problem, and the mercury will, well, there's still a big problem with fish.
Yeah,
Certain
and people,
types of fish have
yeah.
high amount of mercury. So part of when we met, I also educated you on which fish to avoid.
Now, the truth is that since I had known that tuna, for example, has
Mhm.
mercury, when I got pregnant 34 years ago, I basically stopped eating tuna.
Mm.
So I was always very careful because I was aware of it.
Mhm.
The other things you recommended, all apart from the medicine, which I must say that when I started taking it, I was exhausted. I don't. It was really surprising that it's
So
fine now.
you're
that
talking
the
about the treatment
yeah.
for the high low.
Yeah.
Even before you had the silver fillings removed, I suggested for you
Yeah.
to begin supporting the normal detoxification.
And for some
pathway.
reason, when I took the Metal X at the beginning, I couldn't eat. After some time, it was fine. I would say that the other thing that has surprised me with this experience, I have been looking a lot at mercury. So because of research on mercury, so because of that, I looked, for example, the research by Bredesen.
Mhm.
And of course, I was terrified to discover that mercury is one of the causes of Alzheimer,
Absolutely.
which is the thing. I mean, cancer is pretty scary.
And unfortunately, it's the cause that's often minimized or not acknowledged by traditional neurology and memory physicians. And again, in MK Cognition Institute, we screen every single patient who comes through our door for this as a part of the causality. And I think we find it quite often. So, we don't know, but hopefully you taking care of this problem substantially decreasing your future
Yeah.
risk of developing Alzheimer's.
Yeah, it's a very scary thing.
Yeah.
But what surprises me is that physicians, not everybody, but a lot of physicians seem to not read a lot of the most current research. So I understand that they feel challenged when somebody goes in and says, I would like these other tests, or I would like you to look at other risks for Alzheimer. But I also think that science is moving forward, and they need to start looking at the research that's coming out
Absolutely.
to treat their patients well.
Absolutely. Well, thank you so much for coming, and I'm so glad you're doing better.
Well, thank you. I mean, I
You're very
feel,
welcome.
as I said, I feel so scared that what if I hadn't gone to see you?
Mm.
Because I do feel much better. Thank you.
Thank you. That's it.
Awesome.
Thank you.
We don't do cut two. We just